Hi, my name is Allison Noley from Maryville University, and I'm here today to do my head-to-toe assessment. This is Nate, who has volunteered to be my patient for the day. Before entering the room, we had us empty his bladder and placed on a gown. We also got a full set of vital signs, including a height and weight, and tested cranial nerve 2 by testing his distant vision with the Snellen chart and his near vision with the Rosenbaum. Upon general inspection, whenever he came in the room, the patient is a young, healthy-appearing male, walks with a steady gait, is alert and oriented ×4, and acts appropriate to the situation. We're going to start out with just an inspection of the head and the face. So first, just looking at the skin, making sure it's all uniform in color, no lesions or nodules noted. The eyes are at even levels, the ears are at even levels, hair distribution is even over the scalp. Now we're just going to palpate over the scalp, feeling for any areas of tenderness or any masses, also noting the thickness and consistency of the hair. So palpating over the facial bones for any tenderness, masses, or nodules, and feeling over the frontal and the maxillary sinuses for any areas of tenderness. Now I'm going to palpate over the TMJ, have you open and close your jaw, move it side to side, feeling for any clicking, and there is none, so that is good. And now just moving on to inspection of the eyes. So just looking at the eyelids and the eyelashes and just looking for any areas of open skin or any nodules. The hair is even, the eyelashes go out and up. Before digging into the eyes any further, I am going to have you do some facial movements. That is going to be testing cranial nerve 5. I'm going to have you raise your eyebrows, squint your eyes shut, smile, clench your teeth, puff out your cheeks, and stick out your tongue. Great job. Everything's normal there. So also on the eyes, we're looking into the sclera. It's a nice and white and clear. Looking down at the conjunctiva, it is nice and pink and moist. Also palpating over the lacrimal apparatus, looking for any drainage or areas of tenderness, and everything looks great there. So now I'm going to test the pupillary response. I've got a pin light I'm going to shine into your eye. I'm going to have you look straight ahead, and looking at the direct and consensual response, and direct and consensual response. Great. Now we're going to test cranial nerves 3, 4, and 6 by doing your extraocular eye movements. So I'm going to have you follow my pin light here. Good job. And convergence. Great job. And now I'm going to have you cover one eye. We're going to test your peripheral vision. Tell me when you can see my hand.
No. No.
Other side.
No. No.
Great job. And using the ophthalmoscope, we're going to test your red reflex here. Good job. All right, good. And now moving on to the ears. So first just looking at the auricles. The skin is intact. There are no masses or lesions noted. Palpating the auricles, there's also no lesions here, no areas of tenderness. And now I'm going to do a hearing test. That's going to test cranial nerve 8. So I'm going to have you cover up one ear and whisper a common word behind you.
Apple.
Other side.
Peach.
All right, good job. And that was normal. We're also going to test your hearing using a tuning fork. First we're going to do a Weber test. I'm going to strike the tuning fork, place it on top of your head. Tell me if you can hear it evenly in each ear.
Yes.
All right. And now we're going to do the Rene test. So I'm going to strike the fork, place it on your mastoid bone. Tell me when you quit hearing it. Then I'll place it in front of your ear, and you can tell me when you quit hearing it there.
No. No.
Great, that's a normal finding, so the air conduction should be about twice as long as the bone conduction. Alright, so now we are going to look into your ears. So using an otoscope, we're just going to pull the auricle up and back. First, just looking into the ear canal, looking for any redness, any drainage, any nodules. Also looking back to the tympanic membrane, it's a nice pearly gray with no perforation noted. And also looking at the other side here. Great job. All right. So now moving on to inspection of the nose. So first just looking at the skin of the nose, it is intact, the general structure. It is midline, no perforations or deviations noted. And looking up into the nose, the mucosa is nice and pink and moist. And the turbinates are also nice and pink and moist with no lesions or anything noted. The septum is midline with no deviation and also no perforation or open areas. Now I'm going to have you cover up one nostril and breathe in and out, testing the patency. Another side. All right, thank you. And moving on to inspection of the mouth. So first just looking at the lips, they're nice and pink, no cracks or dryness noted. And I'm going to have you open up your mouth, looking into your gums first. They're nice and pink and moist, looking up to the roof of your mouth, the hard and the soft palates, they are intact. And down on the floor of the mouth, skin is also intact there. Also noting the teeth, they're a nice white color with just minimal wearing. There are no teeth missing. And I'm going to have you go ahead and stick out your tongue. So testing just some tongue movements, which is testing cranial nerve 12. So first, just sticking out your tongue, a general inspection of the tongue. No areas of whiteness, just slightly bumpy on the surface, nice and pink. I'm going to look at each side of the tongue, moving from side to side, and move the bottom up. No lesions are noted on any area of the tongue. So now I'm going to have you open up your mouth. We're going to test cranial nerves 9 and 10 with the ah reflex and the gag reflex. All right, those are normal. And also just looking back into the throat, into the oropharynx, noting the pillars, looking at the uvula. It is dangling and nice and pink in color. The great job. And back into the posterior pharynx, it's also nice and pink in color. And the tonsils are at the +1 position, which is normal, no redness or lesions noted there. All right, great job. Also, there's no abnormal breath odors noted. Now moving on to inspection of the neck. So first, just looking for symmetry. It is equal on both sides. The shoulders are at even levels. I'm going to have you raise your shoulders. That's testing cranial nerve 11, and they do move evenly there. Also, just looking, no jugular vein distension noted and no goiter. I'm going to palpate your carotid arteries separately. They're even on both sides and nice and strong. Also palpating down. Your trachea is midline, and also palpating the thyroid. No nodules or goiter is noted. Now I'm going to palpate your lymph nodes. So starting with your preauricle, feeling just for any areas of tenderness or enlargement. Postauricle, occipital, tonsillar, submandibular, submental, superficial cervical, posterior cervical. Turn your head slightly for a deep cervical, each side, supraclavicular, infraclavicular, and down into axillary. And no enlargement is noted there. I'm also going to auscultate over your carotid arteries and your thyroid, listening for any bruits. Have you hold your breath and breathe. Hold your breath. Okay, one time. All right, great job. So now moving on to assessment of the upper extremities. So here we're just going to look at the general musculature, looking for symmetry on each side, also looking at the hair distribution, the color of the skin, and the skin is intact. Also feeling just the temperature of the skin, no changes noted. Looking down into the hands, the nail beds are nice and pink. Capillary reflow is less than 3 seconds. We're also going to check the pulses, the brachial and the radial. They're both strong and symmetrical. All right, very good. Now I'm going to have you go ahead and move over to this chair so we can assess your posterior and lateral chest here. So first, just a general inspection of the chest. I'm looking at thoracic configuration. No barrel chest is noted here. Also just looking at the color of the skin, looking for any lesions, masses, or anything abnormal there. Also looking at the chest expansion. I'm going to place my hands on your chest, have you take a deep breath, and make sure that they both are moving out evenly. And that is good. Also, his breathing is even and unlabored. Also, I'm going to palpate over the costovertebral angles and percuss, checking for any dullness. And that is normal. And now we're going to test tactile fremitus. So I'm going to have you say 99.
99. 99. 99. 99.
Great, and that's over the posterior and lateral chest. Now I'm just going to percuss over the chest, comparing side to side. Also listening for any areas of dullness. That could mean densities. Also doing the lateral chest. And that is normal. Great. And now we're going to test. I'm going to have you lean slightly forward for diaphragmatic excursion. Have you take a nice big deep breath in. Great, let it out. I would mark that spot, have him take a deep breath in and let it all out. And just percuss up until you feel or hear a change there. Would also mark that area, and his is normal, should be about 3 centimeters. And that is good. All right, and now I'm going to move on to auscultate over the posterior and lateral chest. So I'm going to have you take a deep breath in and out, comparing side to side. And that is great. His chest is clear to auscultation with no wheezes or crackles noted. All right, now I'm going to have you go ahead and turn around, face me. And then have you take off your gown, and we are going to assess your anterior chest here. All right, so same thing here, just starting out by inspecting, just looking at the skin, making sure it's uniform, the hair distribution is even throughout. I don't see any pulsations, and his respirations are even and unlabored with no retractions noted. Now I'm just going to palpate over the chest, feeling for any nodules, masses, any areas of tenderness, feeling over the pericardium for any pulsations, and feeling for the apical impulse. And that is great. Now we're also going to check for tactile fremitus in the front, so I'm going to have you say 99.
99. 99. 99.
All right, great. And just percussing over the anterior chest, also listening for any areas of dullness. All right, great. And now I'm going to auscultate your breath sounds. Take a deep breath in and out. All right, lungs are clear to auscultation, also no wheezes or crackles noted anteriorly. Now I'm going to listen to your heart sounds, starting with the aorta, pulmonic, Erb's point, tricuspid, and mitral. All right, great. Now I'm going to have you go ahead and lay down, and we're going to do an assessment of your abdomen. So you can just lay down here. Alright, so first just starting with the general inspection of the abdomen, looking for any abnormal movements or pulsations, looking at the color of the skin is intact, hair distribution is even. And now I'm going to auscultate over the abdomen, just listening in all 4 quadrants for normal bowel sounds. And I'm going to auscultate over the arteries, listening for any bruits over the aorta, renal, iliac, and femoral. Great. And now I'm going to percuss over the abdomen, just comparing the different areas, listening for areas of dullness over the organs. And that is good. And now I'm going to do just a light palpation of the abdomen, feeling for any masses, any areas of tenderness. And I'm sorry, I'm also going to percuss the liver borders here. Good job. So just listening for that dullness, and have you turn on your right side, and I'm going to percuss over the spleen. All right, good job. Go ahead and go back for me. Thank you so much. So then moving on to light palpation over the abdomen, and moving on to deep palpation, also feeling for any masses or any areas of tenderness. And I'm going to palpate over the liver borders here, and then attempt to palpate the spleen, which it is not palpated, which is a normal finding. Also going to palpate the kidneys and the aorta, feeling for any abnormal pulsations there. All right, great. Now I'm going to have you sit up, just looking at the contraction of the abdomen there and the muscles in the abdomen. One thing that I am going to do is test light sensation of your face. So I'm going to have you close your eyes. Tell me if you feel that evenly.
Yes.
In here?
Yes.
And there.
Yes.
All right, great job. All right, so now we're going to move on to just a general inspection of the lower extremities. So just looking at the musculature, the hair distribution, the color of the skin. The skin is intact with no abnormalities. And now we're going to palpate the legs. Also feeling for any temperature changes. Everything feels good there. And I'm going to palpate the pulses. So feeling with the popliteal, the dorsalis pedis here, and the posterior tibial there. All right, that's great. So now we're going to do the musculoskeletal system. So I'm going to have you pull against my hands here. Push. Same with the feet. Great. And now I'm going to test your reflex in your knee. Other side. And the Achilles. Here. All right, and the musculoskeletal of the upper extremities. Have you pull against my hand and push. All right, good job. And then the brachial reflex. Other side. All right, good job. Now I'm going to have you go ahead and stand up for me, and I'm just going to have you do a squat, so just checking the movement in your hips. That's great. And go ahead and bend over and touch your toes. Just looking at the curvature of the spine, any S-curves that could indicate scoliosis, also looking for any lordosis and kyphosis, and everything looks great. Go ahead and stand up for me. And that concludes my examination.